Hi, I'm Cheshire Public School Superintendent Dr. Jeff Solan. I know many of our parents have questions about how we manage student illness. All of us have the same goal of getting as many of our students back into school as regularly as we possibly can. So to help answer some of these questions, I've asked our district nursing coordinator, Miss Nancy Stanton, to join us for a quick Q&A. Welcome, Nancy.
Hi, Jeff.
So what do I do if I'm a parent and my child is feeling ill? What steps should I take?
If your child is home and feeling ill, you should call the attendance line and let us know exactly what their symptoms are that they're experiencing, whether it's a sore throat, cough, fever, etc. If you're not comfortable leaving that information on the attendance line, please call your school nurse and inform her what the symptoms are.
Thanks. So I know that there have been some changes in how we enforce testing and things like that. Can you tell me a little bit about what sort of symptoms I would have to be looking for to determine if my child needs to be tested for COVID or not?
Sure. So we've been in constant communication with Chesapicot Health District, and they've really defined a list of symptoms that we should be looking for. They range from very mild, minor symptoms to more severe illness. The things that Chesapicot at this time is saying we need to really be concerned about COVID are fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea.
So if my child has any of those symptoms, what would be the protocol? So I call in and my child has nausea, what steps then do I have to take as a parent per Chesapicot?
So per Chesapicot and per the Addendum 5 from the Department of Public Health, there are one of three ways the child could then return to school with a symptom that's on this list. They can either see their physician and obtain a note that says that their illness is associated with something other than COVID. They can obtain a negative PCR COVID test, which is the nasal swab that takes about 24 to 48 hours to come back, or they can stay home for 10 days in quarantine just to be safe.
Yeah, I certainly appreciate as a parent the idea of my child being home for 10 days is for a hardship for most. I know it would be for me. And so the testing, I think, will probably be pretty critical. I will add that we on our website have a list of testing centers that people can go. And has it been your experience that it's been 24 to 48 hours on the turnaround there?
It has. We've had many students and people that we've dealt with go to. Midstate has been a great testing site for us, and they've mostly gotten their results back within the 48-hour mark.
Okay, great. Well, I will add too that one of the questions I know that I get from parents around my child being out of school is how quickly, if they have to be out of school, particularly if they're feeling otherwise healthy, can they jump on remote learning? And we want our kids to be able to access remote learning as quickly as possible. In the worst case, it could be up to 48 hours, but we do try and put students on almost immediately so that they can access their classes from home, because we don't want students to feel pressured to come into school if they're not feeling well, and same for parents. We don't want them to be in that position either where they're feeling like their child will be left behind. So we definitely want to connect people into remote learning as quickly as we possibly can. So I hope that this quick Q&A answered some questions for you. We are adhering to Chesapicot guidance, as is Prospect and Wolcott, in order to best protect our community from the spread of illness. And if you have questions, certainly you can contact Chesapicot or visit our website for more information. Thank you for joining us. Have a great day.